Good morning, everyone. At the outset, I would like to thank the Trendo team for the opportunity. And sorry. Right. So the next 10 minutes, I'll be talking about a trial, there is a diabetes remission clinical trial. And most of the slides are really, they belong to the team who did the study, actually. The title goes like this: the durability of a primary care-led weight management intervention for remission of type 2 diabetes. It's a 2-year study, and the results are out recently. It was published in The Lancet, and the results of the direct open-label cluster randomized trial. And the bottom one shows the panel of people who did the study. And we know that the biochemical remission is quite possible these days, with the weight loss of around 15 kg with bariatric surgery or with non-surgical or, like dietary, very low calorie or ketogenic diet, which has been found. So based on that, for the first time, a randomized trial showing a remission of type 2 diabetes with dietary weight loss at the primary care level and its durability as well. The aim of the study was to determine whether a structured, intensive weight management program delivered in a routine primary care setting is a viable option for achieving durable normal glycemia. So other aims were to understand the mechanistic basis of remission and to identify physiological predictors of response, like ectopic fat deposition in the liver, pancreas probably, or the mechanisms which was to be revealed. The main inclusion criteria include type 2 diabetes, a recent one, the diagnosed previously within 6 years' time, the age of 20 to 65, BMI 27, 45, and the co-primary outcomes were weight loss of 15 kg or more, diabetes remission defined as HbA1c of less than 6.5% or less than 48 millimoles per mole, without anti-diabetic medications from the start of the study. And the exclusion criteria, a long list goes, and the main one is current insulin users were excluded, and also the A1C of more than 12%, weight loss of more than 5 kg recently, reduced GFR, heart failure, any other participation in any other trial, substance misuse, known cancer, myocardial infarction within previous 6 months, learning difficulties, current treatment, anti-obesity drugs, eating disorders, or purging disorders, pregnancy or considering any pregnancy, hospital admission for any depression or its treatment. And the study overview or design includes geographically it's in Northern England, there's Tyneside and Scotland, and it's a cluster randomized trial. That means the GP surgeries were recruited, and then each one is randomized by control. By the computer in the Robertson Center in Glasgow, and certain 26 practices were enrolled to control, and 23 centers were enrolled to intervention, and the numbers of participants were equal on both sides, 149, and the control group were put on best practice guidelines as guided by the NICE guidelines or SIGN guidelines of Scottish, with a routine standard diabetes care, with anti-diabetic medications, diet, etc. But in the intervention group, we were put on structured weight management program called Counterweight Plus, which is a dietary approach mainly. And the baseline population, the cross-section, if you look at that, the male 59% mean value, the most deprived from the society, 21, BMI of 34.6, age 54.4, and duration 3 years. And the intervention group were on 75% people were on anti-diabetic medications. The rest of them were on diet only. And the control group had 77 of them. And the A1C to start with in the intervention group was 60.4 millimoles, and then in controls 58. And the Tyneside study population will undergo the magnetic resonance studies of the pancreatic and hepatic fat and certain other metabolic studies, and to know what's really going on at the metabolic level. And at the start, the practice nurse or dietitian who is in charge of the GP practice in the intensive group, she withdrew all the medication, I mean, anti-diabetic and anti-hypertensive medications, and the dietitian put on total diet replacement in the form of formula diet, amounting to 825 to 853 kilocalories per day. It went on from 8 to 20 weeks. It depends. Suppose if somebody achieves a greater weight loss, they put on food introduction. That means they put on back on their normal diet, and it ran up to 6 to 8 weeks. And then once sufficient weight loss is achieved, put on maintenance. And the principle were integrated from not to lose any, not to regain any weight from the day they put on the formula diet, and the monthly appointments were maintained, and blood pressure, blood sugar, weight, all the rest, A1C and other things were recorded. So also the weight and remission and weight expectations were assessed, and the behavioral strategies were incorporated with regard to the weight regain, possible weight regain, and they were motivated to go on exercise and all that. Suppose if they slipped down, and there was a rescue plan with a toolkit approach, and they reviewed the causes of why they gained weight, and they were addressed suitably with the diet, behaviors, and if necessary, the food was withdrawn, and they were put back on total diet replacement and offered hourly start if necessary. And if you look at that 24 months analysis, inappropriate statistics were applied, and 16 withdrew from the intervention group in the year 2, and 86% attended 24 months review, the final review, and data from the GP records for non-attenders at 24 months review was 16. And the data was available, but though they did not come back for the review, ultimately 91% had data available. So if there is no data available, they will assume that they lost. And I mean, the primary outcome was not met. That means they didn't achieve the weight loss or remission. Therefore, analysis include all the participants in the intervention group. If you look at that, data, it's really, really very impressive. At the 12 months time, and nearly 68 out of 149, that means 46% people went in for remission, total remission, without any anti-diabetic medications. And the p-value is so significant. And if you look at the 24 months, it's 53 out of 149, which is, again, not too bad. Actually, 36% is really, really impressive. And the change in diabetes medication, of course, among them, 39% if you leave them out, the rest of them are anti-diabetes medications from the baseline at 24 months, around 51 out of 129 were on drugs. And if you look at the control, they went up a little bit. And who achieved the durable remission, actually? At 24 months, most likely with greater weight loss from the baseline. The more the weight loss, the more the remission was. The greater weight loss at the second half, that's 12 to 24 months, really counted a lot. And the remission did not vary with baseline BMI or duration of diabetes. And it's all the more likely with older age or male sex. And if you look at the weight loss, the intervention group had significant weight loss, achieved the target of more than or equal to 15 kg, that is 11%, and the control is only 2%. And the control was attributed to that, when the results were out at 12 months, direct one was out, the control group started motivated, and they started sticking to the diet and lost weight a bit. And the mean weight loss was less than 10 kilograms from the start and the end, at the end of 12 months and 24 months, 10 and 7.6. And if you spread the various categories of weight loss, less than 5, 5 and 10, 10 and 15, and more than 15, and it's a very linear correlation. And on an average, more than 10 kilograms, if it's lost at the end of the 24 months, 64 were on remission. And of course, the secondary outcomes, and the BP fell down systolic by 4.6 and diastolic 1.4, diastolic 3.6. And of course, the control did not lose much significantly, and the antihypertensive medications went down, and lipids improved. That means triglycerides dropped by 0.4 millimoles, and total cholesterol and HDL ratio increased and improved with regard to the vascular risk, and the quality of life significantly improved. And very few serious adverse events were noted. In the intervention group, interestingly, very few adverse events when compared to the control. There's one fatal MI, non-fatal MI, and one coronary artery disease. And if you look at the control, there's one sudden death which is not explained, and two cardiovascular, cerebrovascular accidents, one aortic aneurysm rupture, and one toe amputations, and 5 cancers, 2 colon, 1 bladder, 1 renal, and 1 prostate. It cannot be correlated really. And to conclude, at the end of the 24 months, type 2 diabetes is not we knew that type 2 diabetes is not necessarily a lifelong condition. It's reversible by weight loss. So far we have been focusing on reducing the complications by intervening with a glycemic control, glucose control, and etc. But now it's reversible. The patient go back as a normal person at least 36% of remission at 24 months, and 70% if they lose more than 50 kilograms. And maintaining weight loss is challenging, really, and people don't stick to that. But it's really very impressive that it was achieved at the primary care level, not as a very controlled environment. They, was handled by the dietitian and practitioners, and more than 10 kg weight loss was achieved by the 1/4 of the intervention group. And more than 10 kg weight loss was achieved by 1/4 of the intervention group. Ongoing support and relapse was very critical, and that limited the further weight gain, and side effects were very less. And it's a very inexpensive one, and early remission should be a primary objective of the diabetes management. That's a lesson we learned today. Thank you.